name is Mark Seiss. I'm the Insurance and Benefits Manager for the City of Albuquerque. I'm here today to talk to you about Open and Switch Enrollment 2010. Now, the biggest question we get in our office is exactly what is Open and Switch Enrollment? Let's start with Open Enrollment. Open Enrollment allows you to enroll into a benefit program that you may not already have already. For example, if you don't have the medical program, now is the time to enroll into that program, and you'll be effective July 1st. Switch enrollment is a little bit different. If you're currently participating in one of our medical or dental programs, switch enrollment allows you to switch, for example, from Blue Cross to Presbyterian, or vice versa, from Presbyterian to Blue Cross Blue Shield. In the same way with our dental program. If you're participating in the Delta plan, you can switch over to United Concordia, or from United Concordia over to Delta Dental. Now, going back to open enrollment, this year the City of Albuquerque is introducing a line of 8 new voluntary benefit products. By voluntary, I mean the employee pays 100% of that premium out there. There is no employer contribution. So I encourage you to visit us on our website to find out more details about those voluntary benefit products. Now, the second biggest question we get in our office about open switch enrollment is from employees who says, you know what, I don't want to switch anything. I'm happy with my current medical providers, I'm happy with my dental provider, and I'm not interested in any of the voluntary benefit products. Do I need to complete an enrollment form? The answer is no. You don't have to complete an enrollment form. However, if you do decide to enroll, make sure your enrollment form is in the office by May 21st. Additionally, if you participate in the flexible spending account, as is customary, you must re-enroll every year for the flexible spending account. So even if you're not taking advantage of open or switch enrollment, but you do want to participate in the flexible spending account because you are participating already, please make sure that you fill out your enrollment form and have it into us by May 21st. Now, additionally, if you are not taking advantage of open switch enrollment, like I said, you don't want to make any switches out there, I encourage you to pay attention a little bit further because there are going to be plan design changes. You may not be switching your medical plans from Presbyterian to Blue Cross, but there are going to be significant changes on our medical plan, so I encourage you to pay attention a little bit further. Regarding those plan design changes for this upcoming July, it's important to note that we meet with our medical providers, our medical, dental, vision providers, all of our carriers, on an annual basis to discuss our rates for the upcoming year. This year, we sat down with our medical providers, and the initial rate increases were 23% and 16%. Now, we as City of Albuquerque employees and the City of Albuquerque as an employer could not absorb 16 and 23% rate increases. So once again, we sat down with our medical providers, and additionally, we looked at the surrounding communities. We looked at the private sector, we looked at the public sector, we looked at what the employees' share for different levels of benefits were in the private and public sector. And once again, we sat down with our benefit providers and we looked at our plan design. We looked at what our level of employee cost share was on outpatient care, on inpatient care, and going to the doctor, visiting our PCP as well. So once again, this year for July, you're going to see some slight increases, some slight changes in some of those benefits offered out there. I can assure you that any benefit that we've had offered to us before is still in place today. We still have the same level of benefits. However, our employee cost share, or either our co-payment or our co-insurance, may have changed slightly. For example, with our PCP visits, our specialist visits, our urgent care visits, those have gone up approximately $10. Once again, in looking at our plan out there, we looked at where our utilization was. Where do our members access their care? And we saw that outpatient care and inpatient care were two of some of our biggest cost drivers out there. So once again, this July, you're going to see some changes on the outpatient co-insurance amount. In years past, we asked employees to share in the outpatient care with a co-payment amount of $150. Starting in July, that's going to change to a co-insurance amount of 20% up to a maximum of $400. The same way with our inpatient care. Inpatient traditionally has been approximately $150 a day. Starting in July, whether you're in the hospital one day or, heaven forbid, you're in the hospital more than that in 20 days, 30 days, whatever it may be, your co-payment is going to be $500. Once again, we looked at the surrounding communities, we worked with our medical providers to find some plan design changes that were equitable and fair, and at the same time kept our benefit program solvent. So, with all the plan design changes made, The premium increases for this coming July are going to be 4.9% for Blue Cross Blue Shield and 8.7% for Presbyterian Health Plan. At the time of this taping, union negotiations are currently going on, so contribution amounts, and what I mean by contribution amounts is our premiums are usually split between the employee and the employer. Currently, the employer pays 83% of the premium and the employee pays 17% of the premium. At the time of this taping, negotiations have not been finalized. We do know what the gross amount, the gross premiums are going to be, and I encourage you, please visit us on our website to find out exactly what those amounts are going to be. But like I said, the contribution amounts, how much the employee and the employer split is going to be, has not been determined yet. But I encourage you, please visit us on our website to find out more details about that program.